Welcome to Marriage and Family Theory Overview, the Gladding Ch Family Therapy History, Theory, and Practice, Chapter 14, Working with Substance-Related Disorders, Domestic Violence, and Child Abuse in Families. Any type of substance or process abuse, domestic violence episodes, child abuse instances related in legal involvement or defects involvement is going to be a situation in therapy where you have a family who has been crippled and ground to a halt. The dysfunction has become so severe that they are not functioning anymore. The impact will be physical, mental, sexual, financial, spiritual, verbal, academic / occupational, and in every part of the community systems. Within substance abuse, you're going to have alcohol use disorders according to DSM-5. DSM-5 differentiates from DSM-4 that it no longer speaks to use, misuse, abuse, addiction, and dependency. It speaks to use disorder, mild, use and misuse, moderate abuse, dependency, where it's every day and it's chronic, and severe, or its dependency is more severe, and addiction is where it's chronic, severe and chronic. Looking at families stuck in a lifestyle that promotes dependency of youth, it promotes a false sense of identity known as pseudo-individuation, where they are having to grow up beyond their age without basic coping skills, without the chance to go through the Ericksonian psychosocial stages and achieve real identity and complete the task in each of those stages. Look at the manifestation of substance-related disorders. Families deal with substance-related disorders in many different ways, typically very unhealthy, dysfunctional methods of trying to deal with the situation and the people involved. One of the primary coping skills is denial. Denial that it's occurring, denial if there's any problem, until it's too late to deny any further. Another way is through the expression of negative feelings. Shame, guilt, and resentment, insecurity, confusion, anger, fury, rage, any of those types of things, where they relate to themselves, their family members, and the community systems in these very negative ways. A third way is to assign roles to members of the family. Typically, the spouse is the enabler or the dependent spouse. The oldest child quite often becomes the family hero, the parentified, adultified child who is going to provide self-worth for the family and take care of the situations, the adult jobs and roles that the parents are failing to do. The scapegoat sometimes is the second child who becomes the identified client, who acts out, who's disruptive, who becomes blamed for the problems of the family, and then brings the family into session. So the identified client is that child, whereas the symbolic client would be the family as a whole. The third and fourth child typically are the family clown, the mascot, the cheerleader, and sometimes the rescuer. And the youngest child, who suffers the most from rejection and loneliness, has been seen to be the lost child. These are all Adlerian roles that he saw within family atmospheres. A fourth way is for the family just to deteriorate, for it just to blow up and no longer become a family, to separate. The parents go to jail, the children go out into foster care, and the family no longer exists. And sometimes it is, another way is when the family focuses all of their energy on the addicted member at the expense of every other member in the family, trying to do interventions, getting into rehab, having accountability partners within the family to try to help parents stay sober. And a final way is is where the family's resources are given all the way to drugs and alcohol, to the point that there's nothing left for the children. There's no home maintained, there is no food in the home. Again, this results in involvement by authorities, either legal authorities or defects typically, and the family ceases to exist. Individual manifestations, confusion around their own self-worth and self-identity, very difficult interpersonal and intrapersonal dynamics, personality disorders. Typically you see things like histrionic, antisocial, narcissistic personality disorders. Attempting to engage others in the family, sometimes when an intervention is tried to be put into place, they involve concerns significant others, spouses, relatives, or children, to try to start the process of getting someone into a rehab or to a clinic. Identified patient or client is usually the most powerful member of the family whose development has been arrested and is resistant to therapy. Also understanding that the symbolic client is always the family. Quite often the therapist will call the person in the family who's most disengaged, who's most unwilling to continue to work with the addicted member, and try to bring that person in. Looking at different approaches for treating substance-related disorders after engagement. Typically, there is a 90% chance of having at least one relapse in the first 4 years following treatment. Family issues are physical, emotional, social, vocational, academic, occupational, certainly behavioral, trying to address the family dynamics that have been involved. In that once the abuse stops, the families have to learn new rules and new roles. The system has to formulate again around stable homeostasis, dealing with coping strategies for substance-related problems, anger, intimacy, defense mechanisms of denial, projection, blaming to minimize or excuse or enable the work and the behaviors of the addict. Looking at structural strategic family therapy, taking into consideration the work of Mnuchin and J. Haley, looking at AA and other 12-step. There's AA for Alcoholics Anonymous, NA for Narcotics Anonymous, adult children of alcoholics, codependency groups, Christian 12-step groups, to lead the family into an education and supportive facilitation process during the early recovery. Bowenian, looking at codependency, a dynamic of family over-responsibility, usually by the spouse or the oldest child, and to look to a balanced state where the individuals with very low self-esteem, like codependents who've become to feel martyred, to become more flexible, adaptable, independent, using genograms, I position statements. Behavioral family therapy, an agreement that the non-alcoholic spouse and anxiety is there to control the alcoholic's drinking, to decrease that. Adlerian therapy, a very strong program for working with families. They have systemic training for effective parenting, the STEP program. Multifamily systemic therapy is another treatment that is quite often used by trying to treat the whole family within the whole system. Use of community resources and prevention, the 12-step groups, the DFACs, church, and some of these other kinds of groups like SMART, Women for Sobriety, Rational Recovery. When you get into families that have domestic violence issues, the rules somewhat change because of the need to protect family members. Domestic violence is aggression that takes place in intimate relationships, usually between adults. It's Kemp, 1998. Spousal abuse, partner abuse, marital violence, physical, sexual, psychological, economic. The most serious is battering, severe physical assault with risk of serious injury. Although men are quite often The abusers, there are times when men become the victims of this, and premarital rates of physical violence are high, about 36%, indicating a lifestyle in a marriage characterized by domestic violence. If you look at assessment, there on page 353 is table 14.1. Physical, sexual, psychological, and economic, the abuse that can occur within a relationship in which perpetrators use specific behaviors. Physical violence, pressured, coerced sex, inappropriately timed or forced sex. Psychological threats, attacks on property, pets, emotional abuse, isolation, using the children. Economic, using transportation, food, clothing, shelter, and money. Looking at pages 354 and 355 is a power and control wheel for physical and sexual violence, using these dynamics, and an equality wheel, and to help your clients understand the differences between relationships that are controlled by domestic violence or relationships that are approached through an equality standpoint. Approaches for treating domestic violence, typically, sometimes both parties are held equally responsible. I know the police department sometimes will arrest both parties. Other times one person is determined to be unilaterally responsible. The therapist has to take responsibility for which treatment option is chosen unless these are mandated by other systems. Conjoint or couples therapy is seeing the couple together. The participation must be voluntary. Special agreements about confidentiality and secret keeping has to be set forth as ground rules from the beginning. An optimal therapeutic stance of neutrality, with only a history of very minor and frequent psychological violence, no risk for lethality, no weapons, taking responsibility for the issues. If the family has actual physical violence and battering, couples therapy is not an option. Intimate justice theory includes the ethical context of abuse and violence in intimate relationships, with 3 ethical dimensions and 9 ethical concepts. This is on page 357, figure 14.4. If you would like to look at that as an option. Also in 14.5 on page 358. Child abuse and neglect. Physical abuse is a continuum from physical contact that's mild, like a spanking, to physical trauma, broken bones, soft tissue swelling, bleeding. Childhood sexual abuse is 1 in 3 girls are understood to be sexually abused by age 18, 1 in 6 boys sexually abused by age 16. And bringing that to light with awareness and being willing and ready to go to court to advocate for these clients, looking at deprivation, failure to provide medical care, shelter, clothes, food, a decent living environment. Looking at other issues that children face in families or delinquency and crime, drug and alcohol abuse, suicide, depression, eating disorder, and the effects of poverty, turning into issues of abuse, neglect, deprivation, mistreatment, and abandonment. Approaches for treating child abuse and neglect are some of the same approaches that you would use originally with other families, with the understanding that treatment cannot occur if the abuse is actively going on. Treatment must occur when the perpetrator has been taken out of the home to avoid treating a child who's going back to the same issue directly after treatment. Understanding the issues of mandated reporting, to be an advocate and a voice for those, for physical, sexual, emotional, mental abuse for children, the disabled, and the elderly, people who cannot speak for themselves. Informed consent issues, release of information issues, a very clear understanding of what mandated reporter means, and providing with safety plans, crisis plans, and not putting your clients at risk for greater harm. Being willing to involve any community, system, or authority that's necessary to protect vulnerable populations within your practice. So the summary and conclusion and summary table are on page 360 to 363. I do not.